Welcome to the Health Conditions YouTube channel. Today we are discussing lupus. Lupus is a chronic autoimmune disease that can cause inflammation and damage to various parts of the body, including the skin, joints, kidneys, heart, lungs, brain, and blood cells. It occurs when the immune system mistakenly attacks healthy tissues, leading to a wide range of symptoms, including fatigue, fever, skin rashes, joint pain, and organ failure. There is no cure for lupus, but it can be managed with medications, lifestyle changes, and proper medical care. Lupus is a complex and challenging condition to diagnose and treat because it affects each person differently and can mimic the symptoms of other illnesses. The exact cause of lupus is unknown, but genetic, environmental, and hormonal factors are thought to play a role. Lupus can also range in severity, with some people experiencing mild symptoms that come and go, while others may have severe, long-term health problems. Early and accurate diagnosis, along with prompt and effective treatment, is important in managing lupus and reducing the risk of serious complications. The symptoms of lupus can vary greatly from person to person, but some common symptoms include fatigue, joint pain and swelling, skin rashes, particularly on the face, neck, and arms, photosensitivity, sensitivity to light, fever, anemia, low red blood cell count, kidney problems, chest pain when breathing deeply, shortness of breath, memory problems or confusion. It is important to note that not everyone with lupus will experience all of these symptoms, and some people may have different symptoms. If you are concerned about possible symptoms of lupus, it is best to talk to your doctor for a proper evaluation. Lupus can be a serious and potentially life-threatening condition. The severity of lupus can vary greatly from person to person, and it can affect different organs and systems in the body. Some people with lupus may have only mild symptoms that come and go, while others may experience severe, long-term health problems, including kidney failure, lung inflammation, heart problems, stroke, blood disorders, nerve damage, cognitive and memory problems. Early and accurate diagnosis, along with prompt and effective treatment, is important in managing lupus and reducing the risk of serious complications. It is important to seek medical attention if you suspect that you or someone you know may have lupus. While the exact cause of lupus is not known, certain factors can increase the risk of developing the condition. These include gender. Women are more likely to develop lupus than men. Genetics. A family history of lupus increases the risk. Ethnicity. Lupus is more common among African American, Hispanic, Asian, and Native American women. Age. Lupus can occur at any age, but it most commonly affects women in their childbearing years, ages 15 to 44. Environmental triggers. Exposure to certain environmental factors, such as sunlight, stress, infections, and certain medications, can trigger lupus in some people. It is important to note that having one or more of these risk factors does not guarantee that a person will develop lupus, and many people with lupus have no known risk factors. If you are concerned about your risk of developing lupus, it is best to talk to your doctor for a proper evaluation and medical advice. Lupus is a relatively common autoimmune disease that affects millions of people worldwide. According to estimates, between 1.5 and 2 million people in the United States alone have lupus. Lupus affects women more often than men and is more common among certain ethnic groups, including African Americans, Hispanics, Asian Americans, and Native Americans. Lupus can develop at any age, but it most commonly affects women during their childbearing years, ages 15 to 44. Although lupus can be a serious and potentially life-threatening condition, with proper medical care and management, many people with lupus can live full and productive lives. There is currently no cure for lupus, but with proper medical care, many people with lupus can live full and productive lives. The goal of treatment for lupus is to reduce inflammation, manage symptoms, and prevent damage to the organs and systems in the body. The following are some common treatments for lupus. Medications, non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, anti-malarial drugs, and immunosuppressive drugs are commonly used to reduce inflammation and manage symptoms. Lifestyle changes, a healthy diet, regular exercise, stress management, and avoiding triggers can help improve quality of life for people with lupus. Medical care, regular checkups with a doctor, especially a rheumatologist, a specialist in autoimmune diseases, and prompt treatment of infections and other illnesses is important in managing lupus. The specific treatment plan for a person with lupus will depend on the severity and type of symptoms, as well as the individual's overall health. It is important to work closely with your doctor to develop a personalized treatment plan that meets your specific needs. Here are a few additional points to keep in mind about lupus. Lupus is a complex disease. Lupus is a complex autoimmune disease that can affect different parts of the body and cause a wide range of symptoms. There is no one test that can diagnose lupus, and the diagnosis is often based on a combination of symptoms, physical exam, and lab tests. Lupus is a chronic condition. Lupus is a chronic condition, which means that it lasts for a long time and can be managed, but not cured. With proper medical care and management, many people with lupus can lead full and productive lives. Lupus can be difficult to diagnose. Lupus can be difficult to diagnose, as its symptoms can be similar to those of other conditions, and the disease can range from mild to severe. A prompt and accurate diagnosis is important in managing lupus and reducing the risk of serious complications. There is a need for more research. Despite its prevalence, much is still unknown about lupus, and there is a need for more research to understand its causes, improve treatments, and ultimately find a cure. Support is important. Living with lupus can be challenging, and it is important to have support from family, friends, and a healthcare team. Support groups and online communities can also be helpful in connecting with others who understand what you are going through. Lupus is a complex and often challenging condition, but with proper medical care, management, and support, many people with lupus can lead full and productive lives. If you suspect that you have lupus, it is important to seek medical attention as soon as possible. Lupus can range in severity and can affect different organs and systems in the body, so early and accurate diagnosis is important in managing the condition and reducing the risk of serious complications. Here are some steps you can take if you suspect that you have lupus. Make an appointment with your doctor. Your doctor can perform a physical exam, take a medical history, and order tests to determine the cause of your symptoms. Keep a record of your symptoms. Before your appointment, it may be helpful to keep a record of your symptoms, including when they started, how long they last, and what makes them better or worse. Ask questions. Prepare a list of questions to ask your doctor about your symptoms, risk factors, and possible tests and treatments. Get a referral to a specialist. If your doctor suspects that you have lupus, they may refer you to a rheumatologist, a specialist in autoimmune diseases, for further evaluation and treatment. Be patient. Diagnosing lupus can be a complex and time-consuming process, as it can mimic the symptoms of other illnesses. It is important to be patient and work closely with your doctor to determine the cause of your symptoms and get an accurate diagnosis. If you suspect that you have lupus, it is important to seek medical attention as soon as possible. Early and accurate diagnosis, along with prompt and effective treatment, can help manage lupus and improve your quality of life. Thanks for watching. Don't forget to like and subscribe for more informative videos like this one.